Just start. Sorry for the inconvenience what we will have. So today I am going to discuss only about OET speaking criteria. Only two criteria I would like to discuss, and that is one is linguistic criteria and second one is clinical communication criteria. Okay, so within 10 to 15 minutes I will finish all these criteria and I will explain you shortly how they will be providing marks based on your communication. Okay, yeah. So just think. So first thing is uh, there are two criteria. Already I have been written in this video. Just I will mark with my so OET will be having two criteria, that is first thing is linguistic criteria, second thing is clinical communication criteria. Okay, yeah. Linguistic, clinical communication. So this is the main two things. So linguistic criteria, there are four subclass it will be. For each one 0 to 6 marks they will give. If you are for this one 0 to 6, how you are performing your linguistic criteria based on this. So in this level, if you are doing well, you will be getting 5 to 6, or if you are poor in this level, you just get 1 or 2. So linguistic criteria will have four what we can say four components to evaluate. Okay, I don't know why, maybe it's the bedtime, so no one had been came for the classes, so it's fine. I will be keeping this recorded means live section in recorded videos. You can refer that. Okay, so every alternative day, Monday, Wednesday and Friday 9:30 p.m. I will be taking the classes regarding OET. I will try to take. We will see what will happen. So if you have any doubts also, you can have the chats over the comment. So regarding linguistic criteria, I will tell what is the four subclasses belongs to this. Okay, in clinical communication criteria, we will be having 6 subclasses. So each one 1, 2, 3, 4, 5, 6. So each one will be carrying 0 to 3 mark. If you are doing better, you will be getting 3 for one component, and if you are doing poor or not well, 0 to 1 marks you will be getting. So total no, only 5 components are there. In this 4 components are there. So we will go what is all those components. So linguistic, what is in linguistic criteria? First thing is intelligibility. So what do you mean by intelligibility? So how understandable your language is, that is called intelligibility. So your languages should be simple and understandable, first thing. And remaining second one is as accent they will be assessed. How your accent is, your pronunciation. In your accent, no mother tongue touch should be there. Example, like a maximum Hindi speaking people will have their way of mother tongue touch in English. Malayalam speaking people will have Malayalam touch in Tamil speaking, Telugu speaking, even each and every people. This northeast side people will have each touch, because their slang is different, so that their accent will be it will be different. So that thing should not be happen. If you are practicing so much of your English languages, so within 15 to 20, if you are practicing for 1 month 15 to 20 speaking cards, your accent will be changed. If you are practicing, it will be changing. Second thing is, third thing is pronunciation. So your pronunciation should be clear, audible, and understandable. They will be in intelligibility. They will see for pronunciation as an and one more thing is volume, pitch, how you are speaking French, and intonation they will be checking. So what is meant by pronunciation? Your pronunciation should be clear, audible, understandable, main thing, and your volume. Medium tone should be used, not high, pitch should be medium pitch, not too high, not too slow. Okay, then intonation. What do you mean by intonation? In some important points, if you are a nurse, I am mainly taking OET for nurses. If you are a nurse, you are giving a recommendation for the patient. So how you will tell, Mr. John, I am suggesting you to take this tablet, pantoprazole, okay, pantop tablet every day by 6 a.m. before in your empty stomach before having your breakfast or dinner, 1 hour before your breakfast, or sorry, not dinner, 1 hour before your breakfast. So you have to stress our Mr. John, I am advising you to take this tablet pantoprazole, which is for mainly for heartburns. You should take before your breakfast at least 1 hour. Like this you have to stress. That is called intonation. They will be noticing your intonation. Okay, accent, understandable, how your language is understandable for that. This is the main thing they will be assessing in intelligibility. What is second thing regarding linguistic criteria? Fluency. How fluently you are talking. This is the main thing regarding English. You should not search for the word. For that, what you have to do? You have to practice so much of your speaking cards. So mainly searching words when it will be happening, no? When you are not okay with your card, if you are not getting understandable, and if you don't have any idea regarding your card, you will search for your language. Okay, so if you are practicing different card setups like excuse me, like unknown case, semi-known case, known case, there are different settings like diabetic cleaning, emergency department, pediatric cleaning, community health, home visit. So there are different types of card setups will be there. If you are practicing continuously, you will be having this fluency. You should not search for words. This is regarding fluency. Third thing is like appropriateness of the language. Mainly, you should not use medical terminology. Medical terminology should not be used. Okay. Second, next thing is avoid repetitions. So some phrases you will be keeps on continuing. So for example, Mr. John, I would like to tell you. So already you have used I would like to. So next time you have to use could you please. According to the sentence, according to the phrases, you have to use however, like that. Okay. And your word should be polite. So this is the appropriateness of the language what they will be using. Fourth one is grammar. So grammar is the one of the component they will be focusing on OET speaking. Mainly, maximum we will be using past tense in this communication. Okay, then grammatical errors should be avoided. No grammatical errors. At maximum you have to buy. Then followed by voice. You have to use voice variation. You have to use both active voices also and passive voices also you have to use. Mainly if you are preparing for OET means what you will be doing, we will be first practicing with reading, writing, followed by what you will do. We will take a grammar session for writing, and finally only we will be taking. So meanwhile, if you are taking any coaching also, so you will be getting grammar classes. That is better. If you are going for OET, please take grammar classes. Then you will know, you will be brush up with this, all these kinds of variation, mainly practicing in this OET. So there are 4 components I have been explained. First thing is intelligibility. What is the intelligibility? Fluency, appropriateness of the language, and use of grammar. So these things will be used if you are doing better. So 4 components are there. 4 into 6 marks. So 24 marks you will be getting. If you are doing well, you will be getting 6 marks. If you are not doing well, you will be getting 0 marks. Like that, for each components, 4 components, they will be assessed. So next thing is clinical communication criteria. So in this, what they have, so this will be having 5 sessions. Each session will vary from 0 to 3. If you are doing well, you will be getting 3. If you are doing poor, you will be getting 0. If it is okay, you will be getting 1. If it is much better, you will be getting 2. This is how you will be assessed. First thing, relationship building. This is the first thing in this. So what do you mean by relationship building? First thing, this is the main thing for the basic OET speaking. Whatever happen, if you are visiting a clinic, who will be who will be starting the conversation? The nurse or the healthcare professional should start the conversation. The patient should not be talking to nurses. So what you will be, if some patient, if some of known cases coming for the diabetic clinic means, what you have to do? Yes, I am the receptionist or clinical nurse in this diabetic clinic. How can I help you? Like that, you have to start your conversation for every OET speaking, depending upon the situation. So this is the relationship building. So nurse starts convo. Okay. Second thing, greet the interlocutor first. So before going through what we can say, so one more orientation I will give. This is the class regarding OET speaking criteria. I am discussing the criteria. Okay. So before you are speaking your role play, first you have to greet your interlocutor. Same thing before starting a conversation. Good morning, myself Ashwati, the one of the clinical or one of the staff nurse in this hospital. I am your attending nurse today. How can I help you? How we are starting? Greeting. With greeting we are starting. So you have to start with greeting. Greet the interlocutor as well as the patient. So this also assessed. This is the part of relationship building. Third thing, be a active listener. What do you mean by that? You should not only listen. Okay. Okay. Like that, you should not give any sort of blabbers or some kinds of sound. Be an active listener means what you have to rephrase the sentence what the patient is asking. If, for example, the patient is telling, Mr. Nurse, I am having a pain over my leg for the past 2 days and it is very difficult for me to manage. Like that, if they are telling means, what you have to be replied, probably how you will be replying means, oh my god, it's very I know it is very difficult for you. um, what we can say, yeah, yeah, of course, I know it is very difficult for you to tolerate that pain. No problem. What you are saying is that what you are, sorry, I will rephrase the sentence. Nurse, I am having the pain for past 2 days. Even though I am putting the medication on time, I'm having consuming the medication on time, I could not able to tolerate my pain. It is continuing since past 2 days, like that. If the patient is telling, means if you are an active listener, what you have to say, uh, oh, Mr. John, I can understand how the pain will be, I mean joint pain will be. Not to be worried, Mr. John, we will do whatever the possible thing what we can do, like that. You have to console the patient, or you have to, repeat. What you are saying is that you are having a joint pain for past few days. Even though if you are having your medication, you could not able to tolerate the pain. Am I right, Mr. John? Like that, you have to rephrase. So that means the patient will understand, okay, you are being actively listening to their conversation. Yeah, so all these kinds of key points will fetch you more marks in OET reading. So this is an example for active reading. If you are doing a role play card, you can came to know how we can interpret all these things. So fourth thing, it should be non-judgmental approach. You should not give an judgmental approach. If the patient is saying, Mr. Nurse, I am taking this company this brand tablet, it is not working out for the for my pain, or I have a previous opioid intake history. Even though I am taking in pain medication, it is not tolerable. Like that, if the patient is telling, means you should have maximum probably what the nurse will do, no, who is not familiar with the conversation, they will be telling, okay, because of your opioid habits only, you can't able to talk, or how high dose of opioid if you are giving, also that morphine if you are giving, also because of your previous history only, you could not able to console your pain. So it is like a judgmental, so it should not be assessed. So, and you should not tell, so this brand of medications will be like this only, you have to adjust, like that. You should not tell, you should not be a judgmental person. So this is about judgment. You should not give any suggestion, or means apart from medical terminology, you should not give any suggestion, personal opinion for the patient. So this is regarding what relationship building. So if you are building a relationship strongly, your marks will be stretched out. So what is second thing? Understanding and incorporative in patient perspective. So we have to understand what's the patient problem, and we have to be in their perspective. Okay. For example, you have to acknowledge your crime. Okay, Mr. John, I can understand that you are having this problem. So we will give you a possible diagnosis. You should not hear and you should not go. Okay, you have to acknowledge. Okay, Mr. John, not to be worried about that. I know that this cause very painful for you. I know your son had been kept in an isolation room. You will be feeling so much worried about your son. Not to be worried regarding your son. We will be taking care. Like that, you have to give a moral support. You have to acknowledge the patient concerns. So that is mean by understanding and incorporating in patient perspective. Okay. Then third one. What is mean by third one? Providing structure to the conversation. You have to provide structure to your conversation. You should not talk, you have to talk in an order, or previously you have to give an idea regarding your conversation. If the patient is coming regarding an advice for anemia, and your GP had been advised the patient to get an diet plan regarding or nursing care plan regarding anemia correction program. So what you will do, you will, okay Mr. John, from your conversation we came to know your GP had been advised you to take a consultation from clinical nurse regarding the anemic diet. Am I correct, Mr. John? Yes. So before proceeding further, I just give you an outline of the conversation what we are going to discuss. Is that okay for you, Mr. John? You have to get the consent. Okay. Is that okay for you, Mr. John? If the patient is say okay, you have to say. So first of all, firstly, like that you have to intonate. Firstly, we are going to. I'm giving a small introduction for regarding anemia, and I will be giving some reason for your anemia. And third thing, I will be giving a brief discussion about your anemic diet. This is how we are going to talk regarding in this conversation. Can I proceed with that? Like that you have to be provide structure for your conversation so that patient will be interested while you are while you are talking to the patient. Okay, so all the conversation should be structured, so it will be giving points for your OET. Okay, outline of information you have, outline of info you have to keep. So this is the important thing. And what is fourth one? So providing information in an organized way. So, providing info in organized way. What is mean by in your cue card? In your cue card there are information which is mixed up. It is a tricky thing. So you have to give. First you have explained what you are going to talk regarding anemic diet. Finally some more points also in cue card will be there. Then after that you have to be talked. Do you have any doubts regarding are you able to understand Mr. John what I have been explained regarding anemic diet? Like that you have to give a question mark. So patient will be having okay, I have understood. And remaining thing, and one more thing also I would like to inform you, like that if any pending cue card things are there, means you have to involve. Or if the patient is having any doubt, definitely they will have some conversation for their cue cards. So patient will be putting one conversation over you, then you will be answering. Like that in organized way information should be provided. So you should not rush up the cue card, this and this and this and this and this, and we have to give we have to give provide information. All the cue cards points should be we have to cover. Like that mindset you should not be there. Mutual conversation should be there. If you are talking one point, you have to ask for the concern. The patient will be telling the concern, then followed by you will be providing information regarding the concern, and after that you will be asking any more concerns you have. Like that then patient will provide, because they are also having one opposite cue cards. They will have also some questions over there and some points over there. You have to allow them to speak also. Okay, then this is providing information in an organized way. When we are doing the cue cards, you came to know what are all the points, all these things are. This is the marks which this is the points which will provide you to fetch the marks. What is the and in this providing information, first thing is you have to provide information in a known to unknown way. First you have to assess the knowledge of the patient regarding an anemic diet. Mr. John, could you please tell me what are all the food that you will be having in your food, that you will be adding in your meals, or like that you have to collect the information. So you will be knowing all the things what are the patient will be eating. And remaining unknown thing means which is the food which is rich in diet that you will be adding. So known to unknown. So Mr. John, what you are saying is that you are having these and these meals in your lunch. So if you are adding dash and dash meals in your diet, your iron level will be increased. Like that you have to interpret and talk. So known to unknown you have to go. This is the first point. And second point, Use of chunking. Chunking means you have to split the information. Abruptly you have to, should not join, you have to split it. You had morning you had this much, night you had been this much, and next day morning you have planned this much. You just give a broad idea regarding the information. Okay, that is mean by chunking, splitting the information, and you are giving the information in the proper way. That is mean by chunking. Third thing is periodic evaluation. After the conversation, you have to evaluate the patient. Mr. John, could you please can you able to understand what I have been said about what I have said regarding iron meals? Could you please somewhat repeat me? Could you please tell me some meals that will be helps to increase iron in your blood? You have to evaluate the patient. So all these things will get you more marks. And this is the three things regarding the providing information in an organized way. What is the fifth one, last one? Gathering information in a last way. Actually this gathering will be going there, and this providing info lastly only we will be providing. First this gathering information will be first. Okay, this thing providing information will be last. First we have to gather information regarding this. If you are, yeah, as I have told before, if you are a nurse or clinical nurse, you have to assess before giving a diet plan. You have to assess the knowledge regarding your patient. So Mr. If it is a female, if the patient is anemic, what you will be asking? You will before giving an what I can say, before giving an education regarding the anemic diet, what you will be saying, Mr. John or Mrs. John, she is a female, Mrs. John, could you please tell me whether your menstrual cycle is regular? Yeah, do you have the habit of smoking or alcohol, anything like that? Like that means directly you have, so smoking or alcohol, like that you should not ask, because it will become a judgmental. You have to get the permission why you are asking regarding smoking or alcohol. How you have to ask means, Mrs. John, may I ask you a personal question, like that you have to ask. Then you have to ask, do you have the habit of socializing, like having a drink or having a smoking, anything like that? If you don't mind, you can tell me. Like that you have to give the patient a consent. Now, so the patient, if they are not having, they will be explaining you, yes, I have this thing. For how many days? For 10 years, like that. And how was your periods, like that you will be asking. Do you know regarding any diet practice for anemia? Do you have any knowledge regarding that, or do you know any familiar regarding that? Do you have the habit of taking any iron tablets in your home by yourself? Like that you have to gather all the information before providing your information in the cue cards. So that is the gathering information. So it will be comes in fourth point, and this providing information will be fifth point. So in this 5 components are there. If you are performing well, you will be getting 3 marks, and if you are performing very poor, you will be getting, so in between 1 and 2 depending upon your marks. So all these things are called clinical communication criteria. So what are all the things in clinical communication criteria will be coming? So in clinical communication criteria, first thing is relationship building. Second thing is understanding and incorporating patient perspective, providing structure to the conversation, gathering information in an organized way, and providing information in an organized way. So if you are, so 3 into 15 is equal to how much? 45. So 3 into 5 is equal to 50. So already I have told 24, 6 into 4, 24, 15. So 9, so 50 marks will be there. Out of 50, if you are getting 35, if you are getting 35 plus, you will be in B score. So for a good score for OET speaking, you should get B plus or minimum B. Some countries will accept C plus also, but it is better to take always P plus score. So linguistic criteria, what they will is 4 into 6 marks is equal to maximum 24 marks. Maximum 24 marks. In clinical communication criteria, 3 into 5 components will be 15. So 24 plus 15 is equal to 9. 3. So 40 marks. Out of 40 marks, if you are getting 30 plus, no, 28 plus, you will be having the score of P. So you will be eligible for Australia, UK, all the things like that. So this is the regarding OET speaking regarding communication. I know my notes are very poor. I will practice because I am preparing for my NCLEX OSCE also, so it is difficult for me to spare some time in a video. So as you have requested, I have given a clinical communication criteria and linguistic criteria for speaking. You just please mark up all those things daily. You just go through daily how all the marks where they it is getting split up, where to we have to concentrate. Okay. So thank you. We will be seeing in the next video regarding OET speaking in next Friday classes. Thank you.